welcome to Beth and Missy Talk. We are back with Lorena Hirsch. Thank you for joining us today. Thank you so much. Lorena has treated both sexual offenders and also victims and survivors of sexual abuse. And so, Missy, what are we going to talk to Lorena about today?
So this is a topic that I've had several people request, and I think it's an area that people want to know, but they're afraid to ask. So we're going to cover a couple of topics today. Number one is maybe some signs that you want to look for behavior changes in children that may suggest that someone may have began touching them inappropriately, and then also how to approach some conversations around that, and maybe looking a little bit more at younger children.
Okay.
So Lorena, what behaviors do you think would parents want to maybe start having some red flags or some concerns if they start seeing those in their children?
Okay, so behaviors in small children.
Yes.
That might be indicators that there's something wrong, and it might not necessarily be sexual abuse, but that there's something bothering them, would be any types of changes. So if you have like a really gregarious, outgoing child that suddenly becomes more withdrawn and clingy, or vice versa, somebody that's really pretty affectionate and cuddly that gets distance all of a sudden. So behavioral changes, I think, is what I would look for. Any kind of behavioral change is an indicator that there's something on their mind, and then I think it's appropriate to maybe start exploring with them what's going on. And I think the most important thing is to not assume that if a child's behavior has changed in some way that there's something going on necessarily, and instead take that as an opportunity to start a dialogue with them, start having conversation with them.
So you'd start with a dialogue, because how would parents start to explore what might be going on?
That's a really good question, and it's an important question because it's important that parents don't become the investigator.
Okay, that's good.
Parents can really interfere with an investigation if they delve too deeply into questioning a child about something. That's important for a forensic interviewer to take care of instead of a parent. So I think you were asking about starting a dialogue. Talking to them about touching, like secret touching, just kind of reviewing the 3 types of touching and asking them how things are going, and are they experiencing a lot of good touching, and making sure that they understand that if there's any kind of secret touching, that it's important for them to, or somebody's wanting them to keep secrets about touching, that it's important for them to come and talk to you as a parent.
What are the three types? You said 3 of touching.
3 types of touching. Yes. Yeah. So this is an important one too. I think that a lot of times parents and educators work on teaching children about good touching and bad touching, and that's very confusing because not all sexual abuse or abuse feels bad. You know, sometimes it tickles, or sometimes there's a more pleasant sensation to it, even though it feels uncomfortable emotionally. So I like to teach kids that there are 3 types of touching. There's good touching. That's touching that feels really good when your mom gives you a hug or somebody pats you on the shoulder when you're doing a good job. And bad touching that hurts, somebody pulls your hair or steps on your toe. And secret touching, that's touching that occurs and whoever is doing the touching doesn't want you to tell others about it. They're wanting to keep it a secret, or they might frame it in terms of being a special thing that's just between them and the child. And so I think it's important for kids to know there are 3 types of touching, and that third one, secret touching, is never okay. There should never be secrets about touching.
That's
is really good because you're right. It's really confusing if you just say good touch, bad touch, parts of the body that's good touch, bad touch. That's really confusing for children.
It's very
Absolutely.
confusing. And it's also an area where they can start taking on responsibility. Like if something happens and it feels pleasurable to them, they know that's called bad touching, then there must be something wrong with them because they like bad.
Right,
Something
which
bad.
is one of those trauma factors. Along with the secrets, right? Because helping children learn to identify that they need to be very mindful when someone says, let's keep this a secret.
Yes.
Yes. I like that.
Yeah, that is really good. What about teenagers? We talk about little kids, but I think parenting teenagers can be a challenge, but what would you do, or are there similar signs? Would you say the signs similar, but the conversation might be different, or the response?
There are a lot of things that I think people use as signs that someone's going through abuse, and it can be very dangerous because it could be related to something totally different. So I really like to look at changes in their behavior and in their functioning. When you have an adolescent that's pretty well groomed and all of a sudden they're wanting to be, like, they're not caring about body odor and they're maybe wearing bigger, bulkier clothes, or, you know, and when they have some sort of a major behavioral change, then it's time to ask about what's going on. And then you can have the same kind of conversations with them. I would hope that they also would be getting the message that there should never be secrecy around touching, that it's always okay to talk to mom and dad about touching. Even if it's hard for mom and dad to hear, they're open to hearing it and willing to work with whatever's going on for the child. So,
And laying that foundation early on, then it might become even easier as they get older. And parents can seek professional guidance, would you say, if they are struggling with
Absolutely. I encourage them.
Yeah, that's actually kind of important because sometimes parents really struggle with the idea that their kids are getting more sexualized in their behavior, and they want to kind of shut that down, and what they do as a result is shut down communication. So
Yeah, a lot of splitting, especially if the offender is someone who's close to or in the family. There tends to be a lot of splitting. And I really like the idea of that open communication because, you know, part of that grooming process is often grooming the survivor into believing that this is something that they're equally responsible for, and that, you know, if something bad happens, it's going to happen to them as well as the offender. So that open dialogue with your children and helping them to feel comfortable with talking to mom and dad about those things. All right, awesome. Thank you so much, Lorena.
Yes, thank you very much. Thank you.
Thank you.